the heart beats 2.5 billion times during an average lifetime. How can one protect one's heart? How can one stay healthy? To know more on this, we have Dr. O.P. Yadava, the CEO of National Heart Institute here in Delhi, joining us. Thank you so much, sir, for joining us on NDTV. Given the heart's never-ending workload, what steps can one take in order to ensure that the chances of getting a heart disease are minimized?
Well, to get the heart disease at the lowest level, you just have to stick to the basic tenets of maintaining a healthy lifestyle, eat well, sleep well, exercise regularly, and keep the stress levels as low as possible. And don't forget that good old days, the practices which we indulged our seniors and our elders in, those were the right practices in terms of good lifestyle. They always had an afternoon siesta. They ate, the whole grain food, and they were really not worried about the modern ways of life where they were always running for name and fame and for marching up the corporate ladder, and they were happy with what they had.
So, Doc, when you talk about diet and sleep and the role that really plays when it comes to heart health, to keep the heart fit and fabulous, take us to the do's and don'ts when it comes to diet. And particularly when we talk about oil, what kind of oil is safe and how much quantity would you consider safe when it comes to using and consuming oil?
See, the first thing I would like to say is that's this age-old Greek wisdom, always take the middle path. So do not go into the extremes. We hear no ice cream, no this, no that, no, everything, but in moderation. That's the most important thing. Second thing is we've got a wrong notion that the blockages of the arteries come only from the fats. No, even simple carbohydrates, and what I mean by simple carbohydrates are things like sugar, things like white bread, potato, white rice, all the confectionaries that we eat. Those are the kind of products, or cola drinks, all sodas that we drink every day, Campa Cola, Coca-Cola, and Pepsi. They are nothing but poison. When they go into the body, the liver converts them into lipids. So simple carbohydrates must be kept low, and we should try and eat as much as possible fresh vegetables, fruits, and cooking is the worst thing. There's a very old saying, God sent the food, devil sent the cook. So the problem lies in the cooking of the food. Tandoori chicken, no problem. But moment you convert it into a butter chicken, then it becomes a problem. So it's not vegetarian versus non-vegetarian. It's how I cook also. Fish is very good, we all know. But if you fry the fish and spoil all its goodness, it's gone. So very important that we take care of the cooking.
Right, Doctor, now that you mentioned non-vegetarian food, we all know red meat is not good for the heart, not good for health. Would you say that one needs to totally do away with red meat, or in moderation, even that, say once a week, once a month, or, maybe perhaps once in a blue moon is allowed?
Well, if you go by science, then the red meat is bad. It is metabolized in the body into certain products called tamao. I won't go into those scientific details, which are not good. But believe you me, if I see a mutton dish and if my mouth is salivating and if I resist taking it, I'm producing more harmful hormones within my body. So it's better to take it in moderation. But as you said, once in a week, once in 10 days, if you have a little piece of mutton, nothing will go wrong. Nothing will go wrong.
So, Doctor, which are the
keep it in moderation.
So you talk about avoiding carbohydrates, but when we talk about fats, and particularly when we talk about oil and ghee, for example, is ghee okay, and how much of it is okay?
Yes, that's a lovely question. Fats are important constituents. Without that, the body can't function. So we realized, after we had said ghee is very bad and all saturated fat is bad, that there are certain essential amino acids which are present there only, fatty acids which are present only in ghee and not present anywhere else. So today we say that half a teaspoon of ghee every day can be taken, but the most important thing is about fats. There is nothing like good oil or a bad oil, you asked the question earlier, we say olive oil is very good. No, it is virgin olive oil which is good. The moment you put the oil on the fire and the temperature goes above 100, what happens? There are certain harmful products called fatty acids. These are the ones, free fatty acids, which are, or trans fats, which are most damaging. So even that little ghee you take, you make the roti or paratha on the tawa, take it off and then apply that rather than applying it direct on the tawa at which it is exposed to very high temperature. And that is the problem when you have multiple frying occurring in the same bowl or kadhai. You have pakoras and samosas going from morning till evening, which is full of trans fats. So whenever we
So
use an
reusing
oil, it should be single use oil.
Right, reusing oil is a complete no-no, especially
Absolutely.
for people who perhaps have a heart issue in the family. So when we talk about poor genes, for people who perhaps have, say, heart issues in the family, what are their chances of having heart issues, and what should they be particular about?
Definitely, if one of the parents have a history of heart disease or heart attack, then your or the sibling, the children's chance goes to high by 4 to 6 times. So, if there is a history of coronary artery disease or heart attacks in the family, then see there are two important things. One we call nature, second is nurture. Now, nature means the genes that you get from your parents, they are against you, because if your parents have heart attack, you are 4 to 6 times more prone. But then the nurture is in your hand, how you nurture yourself. So these are the people who should, right from the beginning, and this is important, right from beginning means right from day one of life. Most important period is the school time. We all become very wise and start practicing good healthy practice at the age of 60 plus. Sorry, that's a bit too late. It
It's too
should be
late.
in the school that these healthy practices are introduced of not taking to these sweetened juices and products, regular exercises, and doing yoga and meditation, which is wonderful. Sleep is very important, and avoidance of excess of tea and alcohol are, they're no brainer. Everyone knows that.
Right, doctor, when you talk about sleep in particular, for some of us who don't have the luxury to get, say, 8 hours of sleep non-stop, if I break up, say, my sleep pattern to 5 hours and then, say, compensate it with another 2 hours later in the evening, does that really work?
Well, it works more than not sleeping more than 5 hours. Certainly, sleeping 7 hours, even in two fragments, will be better. But is it the same as the unfragmented sleep? The answer is categorical no. We need a minimum of 8 hours of sleep. And there are two components in sleep. One we call the REM sleep, and second we call non-REM sleep. And both those components are extremely important. In fact, our memory is dependent on these sleep patterns. Our function of the entire body, the hormones, and all those things is dependent on our sleep. So the sleep medicine today has come up in a big way. This simple snoring, which we used to ignore earlier and laugh it out, today sleep medicine is a specialty on its own, and we know people who have snoring are more prone to heart attacks. So sleep, try and have 8 hours of unfragmented sleep, no question.
Right, doc, take us through the do's and don'ts during a heart attack and do's and don'ts after a heart attack. Say when perhaps the surgery is over, with they're back home. So, what are the do's and don'ts you would recommend, especially during the time of a heart attack? And there is a certain golden period which is considered safe to get the patient to the hospital.
Yes, there is definitely a golden period. Typically, the golden period is called the golden hour. That is the first 60 minutes. If you reach the hospital and the hospital is quick enough to do a quick angioplasty and open that artery, then the damage to the muscle cells is virtually zero or negligible. So that's the golden hour. But if you even reach within the first 6 hours, the damage to the muscles can be reduced tremendously if you open the artery and restore the blood supply. As far as do's and don'ts are concerned, the most important do is that relax the person. Please tell him, don't worry, you'll be all right. Come on, it's nothing. Keep him in a very well ventilated, don't crowd him around him. If he's wearing some tight things like tie and necktie and thing, open those. Please, for God's sake, do not put any water or any such thing in his mouth, which if he's got certain slight obtundation of consciousness, it can go and trickle into the lungs. If you have got an aspirin tablet, then a dissolving aspirin or simple Dispirin, which is available in the market and most homes have it. If it can be dissolved in about a small quarter glass of water, then patient can be made to drink that aspirin. That could be life-saving because it can prevent the blood clot from extending, or even dissolving it can help in that. And if
Right.
the patient...
Doctor, sorry for interrupting. Any alternate to aspirin and Dispirin? Is there any other medicine that works at this time?
Well, at this time, for a lay person, it will be very difficult. Obviously, if you've got sorbitrate tablets at hand, then sorbitrate can be put under the tongue, which is a drug which dilates or expands the arteries and increases the blood flow. And the most important thing is to rush the patient immediately to the hospital. Don't make your own things, though it is stomach upset and it is gas and acidity. Time is muscle. Time is life. If you lose it, you can lose the life. So give these drugs, but rush him to the hospital or her to the hospital.
Right. Doctor, say post-surgery, what are the do's and don'ts?
Post-surgery or heart attack?
Post-heart attack, you made, like during the heart attack, you asked us, to not to crowd the patient, etc., etc. Now that we've, perhaps reached the hospital and the surgery's been performed and the person's back home, what are the do's and don'ts?
So when you reach the hospital and the doctor has done his bit, then he will always give you the correct instructions. And the most important instruction, we have gone with the days of masterly inactivity where you put the person in bed in total bed rest. The answer correct today is absolute no, no, no. These patients should be mobilized, made to move around, should even leave the home and walk in the park in a small graduated fashion so that they keep increasing the pace every day. If there is any sweating, breathing difficulty, chest discomfort, immediate medical help should be sought. Otherwise, you keep increasing your activity level. Secondly, you improve on, that's the right time to make resolutions. This is not only to make resolution, but to implement them. So change your habits of food and start walking.
Doctor, you say walking is good, but what about steps? For a heart patient, how bad are steps? Is it safe to take steps?
No, they should take steps because one of the most important causes after heart attack of serious life-threatening complication is deep vein thrombosis. So obviously, if a person has had a massive heart attack, he is in heart failure, he will not be discharged from the hospital and doctor will tell you not to go. But after the heart attack has stabilized and you're discharged from the hospital, then graduated mobilization is important. In fact, the word is, may I finish this? Word is symptom-limited activity. And that is the golden phrase which everyone must realize. Symptom-limited activity. Any activity which does not give you a symptom, please do it. If walking 10 yards gives you chest pain, don't walk.
Doctor, walking on a flat surface, we all know is good for us. But walking up the stairs, taking a staircase, is that safe for a heart patient?
Certainly, walking in a flat ground is perfect, but if you live upstairs, no point being lifted in a wheelchair or in something. You walk 3 or 4 steps, give a little break, take your breath, walk 3-4 steps, and you can take those steps in a graduated fashion. And immediate after heart attack, maybe 5-7 days, you may like to avoid it. But in 10, 12, 15 days time, you should start getting back to normalcy, and walking up and down the stairs is very much on the cards. And in fact, we do it in the hospital also. Sometimes we make the patient do what is called treadmill test for risk stratification after a heart attack. I'm not suggesting patients start doing the treadmill themselves by walking up and down the stairs, but very slowly, gently going up the stairs, taking break in between is absolutely safe and there is no concern about it.
Right, doctor, there's a myth that women don't get heart attacks. So as many women as men get heart attacks is something that goes unreported. When we talk about women, mostly it's so silent or so disguised that it perhaps goes unnoticed and therefore doesn't get reported as much.
Well, you are absolutely right. This is a very nuanced question, and we must understand below 40, definitely women do not get heart attack to that extent that men get it. So the ratio is 1 in 10. That is, for 9 men, 1 woman will get a heart attack. From 45 to 60, the women start catching up with the men. And we have noticed, and this is not we, it is textbook knowledge, beyond 60, in fact, women start having more heart attack than even men. So that is one element, that they are not immune to it. Second, yes, women, once their nature is such that they are always compassionate, that altruistic nature in them, that they will look after the family, their children, their husband, and they will ignore themselves. So if a woman gets a chest pain at 6 o'clock, she will not complain of chest pain. She will pack the breakfast and lunch and dinner for the children and husband, and then at 10 o'clock she will report she has got chest pain. So they present late to the hospital. Also, because of breast and because of certain hormonal reasons, we sometimes miss the diagnosis. We think it is related to the breast, the chest discomfort, and we are not able to diagnose them. So they are diagnosed late, and then also we have shown that they do not get the same treatment as the men folk. That unfortunately is the gender bias of the society, and I'm ashamed to say even in medicine we do have, there is no doubt about it.
Right, doctor. Also, when it comes to diabetes, diabetic patients, when they get a heart attack, it is often disguised, and it could perhaps be misunderstood as indigestion as opposed to a heart attack.
See, what happens in diabetes is that the nerve endings get damaged. That is what is called autonomic denervation or neuropathy. So when the nerves are damaged, then the perception of pain is lost. So these patients who are diabetic can have a heart attack, and they are not having any pain, just slight perspiration, which is out of proportion to the climate at that particular time. Or some of them may have referred pain referred to the jaw. You may think that it's a toothache, pain referred to the abdomen. One thinks in terms of ladies that it is a gallbladder inflammation, or pain shooting to the back, we put it off as spondylosis. So diabetic patients may have atypical presentations. So very important, if you get any symptom for which you do not have valid explanation, it should be taken as coming from the heart, and you must visit your doctor.
Right, doctor. Finally, just all the symptoms possible that could perhaps lead to symptoms of being a heart attack. That just cover all the symptoms. Like we do know if it's a left arm, sweating, like you mentioned. What are the other symptoms one needs to look out for?
Okay, let me first, when we were students, one of the question was, what is the commonest presentation of heart attack? Please, the correct answer is sudden death. So everyone must realize that presence of symptom is not required to detect coronary artery disease, and people who are vulnerable beyond 35 years of age, who have family history of heart attacks, who have diabetes, hypertension, obesity, stressful life, they must go for an executive health check to find whether their heart is healthy or not. They should not wait for symptom. Now, if symptoms you are referring to, obviously the classical thing is pain in the left chest radiating to the arm, but the pain can radiate to the right side, can radiate to the back, to the jaw, to the abdomen. So that could be pain. It can be just choking sensation in the throat. It may manifest as breathing difficulty. It may sometimes feel as just being unwell and listlessness, and disproportionate to the climate, sweating occurring. In a winter month of December, you're sweating, then you must ask, hey, why are you sweating? So these are some of the atypical presentations of heart attack, but the commonest presentation remains that there is no symptom and you present suddenly with collapse of the blood pressure and low blood pressure.
Right, doctor, precaution is absolute cure, and especially when it comes to heart health. Thank you so much for all your insightful information that you've parted with our viewers today. Thank you for joining us on NDTV.